It's time for our nursing tip of the week, and in this week's tip, we're talking about where to check a pulse for CPR. As an ICU nurse, I've been in my fair share of codes, and I can't tell you how many times I've seen people check for a pulse in the incorrect location. Before we talk about the CPR aspect, let's just think that we have a patient with a super low blood pressure. I'm sure most of you have heard that when a patient has low blood pressure, the blood shunts to the patient's core in order to try and perfuse their vital organs. This means that the blood flow is not very good to the patient's extremities, aka their arms and their legs. So if we have a patient that we suspect is having a cardiac arrest, we do not want to waste time checking a pulse in their radial artery or on the arteries that are on their feet. Instead, you want to check for a pulse in the carotid artery. If the patient has enough of a blood pressure where they're not quite having a cardiac arrest, you should be able to feel a pulse in the carotid artery. You can also check for a pulse in the femoral artery because this is, again, is another big artery that is closer to the core. This is for your adult patients. In pediatrics, they teach you to check for a brachial pulse, but for your adult patients, the best place to check is the carotid as well as the femoral. You can also feel for a pulse while someone is doing chest compressions in order to see if they are doing effective chest compressions. Now, this is not really the gold standard way to ensure effective chest compressions. We like to use end-tidal CO2, but sometimes we will have someone manually hold for a pulse check in the groin or the carotid or use a Doppler in order to ensure that chest compressions are being done effectively. And that's your nursing tip of the week. Let me know if you have any questions.